Dr. Stuart Rammell with Pinnacle Pain and Spine. Today I want to take a few minutes to talk about one of the more advanced interventional pain procedures that I offer called spinal cord stimulation. The way that spinal cord stimulation works is we place electrodes in something called the epidural space. The epidural space is the space within the spinal canal that's on the outside of the fibrous sac where the spinal cord and nerve roots run. With these electrodes in place, we can induce a small current over the spinal cord that modulates the way that chronic pain signals are sent from the periphery and then interpreted from the spinal cord going to the brain. Spinal cord stimulation is something that has seen tremendous growth and expansion over the last 10 years due to the vast amount of research that has gone into it. It's also something where we've seen a great expansion of the programming capabilities for it. Many patients do very well with this procedure, and it allows them to reduce their pain, improve their function, and get back to doing the things that they love doing. Now, the most common indication for spinal cord stimulation is folks who have chronic low back and or leg pain, despite having gone through other conservative and potentially interventional options. Now, the way that spinal cord stimulation works is twofold. There is a trial process and an implantation process. During the trial process, we test to see if this therapy is something that will be beneficial for our patients. It's kind of a try it before you buy it process that we go through. So the trial period, we use needles, very similar to some of the other interventional pain procedures that you may have had, where we place needles through the skin and access the epidural space, place the electrodes in, get them to where we want them using the live x-ray, and then remove the needles, leaving the electrodes in place. And then we tape everything to the back and tape a small external battery to the side. And then we use this therapy for the duration of the trial period, which is generally between 5 and 7 days. If patients have an excellent response to this, meaning that they have drastic improvement in their pain, improvement in their function, then they would be excellent candidates for moving on to the implantation portion of the procedure. Now, when these systems are implanted, it's a slightly more complex procedure, but still relatively very minimally invasive, where instead of going through the skin, there's a small midline incision made, and then the needles are placed through that incision, and then the electrodes are secured down underneath the skin, and then tunneled to a site where we implant a battery in either the low back or the buttock. Incisions are closed with sutures, and then you have routine wound care, and of course you'll have close follow-up with my office during that portion of the process. Spinal cord stimulation is something that I'm very passionate about, and I've seen great results in patients. If this is something that we've already discussed and you are in the process of going through the trial, or you've had the trial and you're moving towards implantation, I really hope that this is the right therapy for you and that we're able to get you back to doing the things that you love. Now, if this is something that we haven't talked about, but you feel like you would be a good candidate for this, then come into my clinic and let's talk about it and see if we can potentially use this as an option for getting you to the place where you want to be and help allowing you to meet your goals. Now, I will say that with spinal cord stimulation being one of the more advanced options, this isn't something that I offer to every patient, and this isn't necessarily something that's right for every patient. I could have a patient that comes into me and says, "Doc, I've been having pain in my back or in my leg for 3 or 4 months, but I haven't tried anything else yet." This isn't something that I would use for patients like that. We'd have to go through the conservative options of physical therapy and medications, and then potentially other interventional procedures or potentially surgery, like I've spoken about. But in folks who have gone through that, and if you're one of those people who have gone through all those things and continue to have this type of pain, spinal cord stimulation is something that could be very beneficial for you. Like I said, it's something that I'm very excited about and something that I feel very grateful for, that I can offer this to my patients. So, like I said, if we haven't talked about this yet, come see me in clinic and we'll find out if this therapy is right.